Good evening. Welcome to the Blessing of the Hands program here at Carson-Newman University. Thank you, Dr. Wood, for the prelude music. This is a different year. We're not allowed to have a lot of people in the hall, so this will be shown again for families and friends that want to view this. We hope that you will enjoy this evening's program and then also see it as a challenge as we welcome you into the profession of nursing. I'd like now to welcome Dr. Christine Jones, who will be leading us in our opening prayer.
Pray with me. God, in the beginning, you made humans to be your image bearers. You gave us eyes to see and ears to hear. Grant these nurses the grace to see your image in their patients and the clarity to listen attentively to their needs. You gave us mouths to speak. Grant these nurses wisdom as they speak to and often for those in their care. You gave us feet to carry us through the sometimes smooth and sometimes rocky paths of life. Grant these nurses the strength to keep moving toward those who need their expertise. You gave us hands to touch and care for so many things. The psalmist often speaks of your hands, O God, how your hands consistently and lovingly guide and protect us. God, we ask that you bless the hands of these nurses, whether they are dry and cracked from repeated washing or gloved for protection, whether administering life-giving medication or bringing calm and kindness through a gentle touch. May the guidance and protection of your loving hands comfort and support these nurses as they use their hands to comfort and support countless others. We ask all of these things in the name of your Son, Jesus Christ. Amen.
You are participating tonight in a very special ceremony. It was established by Dr. Arnold Gold, who was a renowned pediatric neurologist. He passed away a couple of years ago, but he left his legacy with us. It was established as what was called the White Coat Ceremony, and he was a professor of medicine at Columbia University for a number of years. And through all of his time there, he was really an advocate for compassionate, humanistic care for all of the patients that he and his staff served. As a result, he established what is called the White Coat Ceremony, and Carson-Newman has adapted that with the permission of the Gold Foundation to be the White Coat Ceremony. And he realized that all of us take oaths at the end of the time that we finish our education, whether it be physicians or therapists or nurses, but he realized that it's too late when you get to the end of that period of time. So he saw the white coat ceremony as an opportunity to again realize that blessing of the hands and all of that compassionate care that goes along with everything that we do. So as Carson-Newman nurses, we want to start out with the blessing of the hands. And again, as you go forward and provide care for all of those that you're cared for through our program and on to when you become nurses.
Hello, my name is Jenna Frost, and I teach mental health nursing for the undergraduate nursing program, and I'm very excited to be with you all tonight. I remember attending my first blessing of the hand ceremony and being moved to tears watching nursing students being prayed over before beginning clinicals. One reason I'm sure is that I was 6 months pregnant, but it was more than that, and it made me think, why is this ceremony so special and moving to me? And it hit me. As a nurse, it really is all about your hands. Let me explain. I come from a family of nurses, so it was easy for me to jump on the bandwagon and say, me too. I was never able to answer the question of why do you really want to be a nurse until July of 2011. I was set to begin nursing school the very next month, and my dad became very, very sick. He would spend the remainder of 2011 in the hospital, discharged home on Christmas Day. He spent almost 6 consecutive months in the hospital. I watched my dad get sicker and sicker as the weeks went on. I traded shifts with my mom, staying all night, and I watched day after day, night after night, nurses care for my dad. I will never forget one day showing up to the hospital alone to take my shift of sitting with my dad. I knew that hospital, and especially the 11th floor, like the back of my hand. I turned the corner to enter room 1110, and the room is in complete shambles. What I didn't know then, but I do know now, is my dad's room had experienced an emergency situation. They had ran a code in that room. Most importantly, my dad was nowhere to be found. He had been transferred to the ICU. I remember panicking, having tunnel vision. I was alone and scared. My dad's nurse found me and explained what happened and led me to his ICU. But let me tell you, it was her hands. Her hands on my shoulder grounded me. Her calm voice and her hand in mine as she escorted me to the ICU made one of the scariest days of my life a little easier. I knew then that I wanted to be a nurse. I wanted to be that comfort to someone in their family as that nurse had been to me. Fast forward a few years, and I have graduated, and I'm working as a nurse at UT Medical Center. I worked on the same floor for 5 years doing vascular surgery and transplant. I can tell you some pretty average things that my hands have done as a nurse. I have opened more pills, filled more ice cups, emptied more urinals than I can count. I have charted thousands of care plans and nursing rounds, and I have made hundreds and hundreds of phone calls to phlebotomy to hunt down my labs. I can tell you some downright hard things that my hands have done as a nurse. I have held hands with patients to tell them that they were in antibody-mediated rejection. I have laid hands on a patient's shoulder when they received the news that their blood work was positive and they actually would not be receiving their life-saving organ transplant. I have held hands with patients when their pain was so great that medications did not take the edge off. I have used my hands to perform CPR until they were sore and ached. I have used my hands to comfort patients after they watched their family members die and while they watched their family members be resuscitated following a code. And I have held the hand of dying patients both in peaceful and traumatic situations. I can tell you some really awesome things that my hands have done as a nurse. My hands have worked feverishly to hold pressure on bleeding grafts and ruptured fistulas. My hands have worked skillfully and carefully to open fluids and medications in rapid responses. My hands have had to be calm and steady to draw blood, manage art lines, insert IVs and catheters. My hands have changed dressings, replaced wound vacs, suction trachs. They have worked quickly like a magician to clamp art lines and wound vacs to stop life-threatening bleeding. I can tell you some joyful things that my hands have done as a nurse. I have held hands with patients before surgery when they receive their life-saving kidney transplant. I have held hands with family members when they get the call that their loved one's blood flow was restored via bypass and they didn't need an amputation. I have clapped and cheered for patients who regained strength and the ability to speak following strokes. My hands have clapped and celebrated with patients who learned to walk using prosthetics following an amputation, and my hands have hugged coworkers many times for their accomplishments. Now, when I'm not teaching, I work as a psychiatric nurse practitioner doing consults in nursing homes in Jefferson City. And let me tell you that during this pandemic, my hands have been my greatest asset. These elderly residents, most with some degree of dementia, have not seen their families in over 11 months. They have missed Easter, Mother's Day, Father's Day, Thanksgiving, and Christmas. On top of that, their routines have been shattered. There are no group activities or communal meal times, no exercise class, no free roaming of the facility, but my hands. I have been able to provide physical touch, albeit with PPE and gloves, but physical touch that is so important for survival. I have held their hands, I have hugged them, and I have bridged the gap between complete isolation and the love of their families. This pandemic has really shown me that my hands are a blessing. I often think about Jesus and how he used his hands to serve and to heal, and I'm going to share with you some of my favorite examples. This is from Mark 7:32 through 35. There, some people brought to him a man who was deaf and could hardly talk, and they begged Jesus to place his hand on him. After he took him aside away from the crowd, Jesus put his fingers into the man's ears. Then he spit and touched the man's tongue. He looked up to heaven and with a deep sigh said to him, "Be opened." At this time the man's ears were opened, his tongue was loosened, and he began to speak plainly. This one is Luke 4:40. At sunset, the people brought to Jesus all who had various kinds of sickness, and laying his hands on each one, he healed them. Luke 13:10 through 13. On a Sabbath, Jesus was teaching in one of the synagogues, and a woman was there who had been crippled by a spirit for 18 years. She was bent over and could not straighten up at all. When Jesus saw her, he called her forward and said to her, "Woman, you are set free from your infirmity." Then he put his hands on her, and immediately she straightened up and praised God. Now, I'm not saying that you will use your hands to call out demons or heal leprosy, but as you begin your clinicals, my prayer is that you see your hands as a gift, a vital tool as a nurse. Your hands will sometimes work fast, and there will be times when they are idle. They will feel useless at times, and they will feel strong and capable at others. Some days they will let you down, but more days than not, they will be your lifeline and a great resource. So in conclusion, it makes sense to me now. I didn't just cry at this ceremony because I was a very pregnant and hormonal woman. I cried because it is a privilege and a gift to be a nurse. I believe it is truly a calling. I hope as you begin your clinicals, finish your clinicals, complete your first year as a nurse, and someday become a senior nurse, because once a nurse, always a nurse, that you remember this day and you remember the power of your hands.
If you'll stand now and take your program, the oath is on your program, and we'll recite it together. And following that, you'll come across the stage to receive your pins. Okay. I solemnly pledge, all together now, I solemnly pledge myself before God and in the presence of this assembly to practice my profession faithfully and to live my life in a way that reflects the values of truth, beauty, and goodness. In the care of the individuals, families, and communities, I will provide safe and effective, compassionate nursing care, demonstrate sensitivity to culture and values, advocate for holistic needs, maintain confidence of personal matters, collaborate with the healthcare team, evaluate the standards of my profession.
Lauren Allen. Devanishi Barrett. Cherish Campos. Macy Danielson. Kara Franklin. Lexi Harrison. Caroline Hazelwood. Lauren Hensley. Lindsay Janik. Renlina Lola. Morgan Mary. Alexis Nibby. Savannah Reddy. Alyssa Rose. Melody Sarah. Kendall Schinlever. Jenna Starkey. Caitlin Toussaint. Tabitha Tucker. Brooke Wakefield. Braylon Wickle. I apologize, Wickle. Seth Arrowwood. Madison Bowman. Emily Buffalo. Kari Cole. Lindsay Cornett. Emily Eveline. Madison Fritz. Alondra Gonzalez. Arlette Guerrero. Luis Hernandez. Keaton Hubbs. Emily Johnson. Hannah Lip. Lindsay Long. Leah Mitchell. Rachel Olevi. McKenna Rejo. Gabriel Stevens. Gracie Thompson. Hannah Turley.
Will you stand, please, and receive the blessing? Normally, we would give a blessing to each of you individually while holding your hands, but obviously we can't do that right now. So I would ask, if you feel comfortable, to place your hands in the position of receiving. All right, so if you're going to receive someone, you would open up your palms. So receive this blessing. Almighty God, may you bless the hands of these student nurses. In the years ahead, may each pair of hands that represent breadth of heart and vocational service touch others with care, healing, patience, hope, and love.
As you first start to care for patients, it'll seem like you will remember each one of them for your whole life. You think, I will never forget this patient. The reality is that as time goes by, there will be lots of patients that you give really good care to, and then you just don't think about them anymore. More patients come in, you're focused on them, but there are a few patients that you never forget. One patient who is like that for me I worked in the NICU when I first got out of school. And I had admitted a baby, a little tiny baby, right at shift change. And shift change is so busy, and it was the last thing I wanted to do at 15 till 7. But that's when he came. And so when I went over to labor and delivery with the neonatologist, I noticed there was a policeman standing by the door. And I thought, that's weird. And I went on and did what I do. Well, after I got him all admitted and headed out to the parking lot, you know how you can kind of feel if somebody's walking up behind you, like they're walking up to you, and I had that feeling. And it was the nurse from labor and delivery. And I could tell she was wanting to talk to me. She said, did you know what that mom did? You admitted that baby, you know what she did? And I said, well, no. And she said, she has 2 other kids, and she knocked out their front teeth with a hammer, and she's in jail. And I was like, well, okay, that poor little baby. And I went on home, and I could not get that baby out of my mind. I cooked supper and did all the stuff you do when you have a 2-year-old and a 4-year-old, and got everybody put in bed. And I just could not help thinking, in the morning, I'm going to have to deal with that woman, because if you admit a baby on one day, then you're there the next day, you have that baby as your assignment. And sure enough, when I got there the next morning, there was that little baby's name beside mine. And I thought, well, maybe she just won't come over here. But of course, about 8:30, the ward clerk came back and she said, this mom's here. Do you want me to just tell her she can't come in? And I was like, well, no. And she's like, okay. And so I saw her out there scrubbing her hands, and she came around the corner, and I motioned for her to come on back. And she just stood there at the isolette for a few minutes. And I walked over to her and said, hi, I'm Angie Wood. And, do you want to hold your baby? And she didn't say anything for a minute. And then she said, you mean I can hold him? And I said, well, yeah. And she said, did they tell you what I did? I said, yeah, they told me. And she said, and you're still going to let me hold him? Well, now, I had been, at that point, going to church 3 times a week for 30 years, okay? And Bible school 2 weeks out of the summer, all those years. You'd think some Bible verse would have come to me, or something from a message I'd heard sometime. I had nothing. Finally, I just said, I'm here to be your nurse, not your judge. Let's get this baby out. As far as I know, that's the only time she ever got to hold her baby. They took custody of him, and he was given up for adoption. And a lot of people were kind of aggravated at me because I let her hold him. But as I said to her, I was not her judge, I was her nurse. And shouldn't she get to hold him one time? I would encourage you, as you find yourself in these kinds of situations, and you will, that you remember the grace that God gives to us. And let's see if we can't share a little bit of it with the people that we come in contact with. Thank you all for coming tonight. Go forth and heal.